Some tongue ties are so obvious that anybody looking at a tongue with a really obvious tongue tie where it is tethered basically almost to the tip of the tongue would look at it and say, oh, that's not right. But his type of tongue tie, which is what they call a submucosal or posterior tongue tie, it does not look that way. So to the naked eye, when you lift the tongue, the normal person doesn't see that big sail or band of tissue there that might be short or tight. But you can't really visually see it, but you can see the limitation of his tongue. So that was the big thing, is that normal movement of his tongue was not possible.
Right.
And without that, you can't really so effectively remove milk from the breast. Now, he was able to, again, because you had a good milk supply and all these other compensatory things. I noted when I met him that he had a pretty deeply recessed chin.
So right off the bat, you showed me kind of how to help kind of work the nipple into his mouth.
Yeah, kind of that flipping, sort of ridging the tissue and then flipping it into his mouth. That's right. And one side he seemed to like one position, the other he liked a different position. That may just be how he was able to, get a better deep latch, on that side, because all of his tissues being sort of tight, his muscles being tight, can definitely be affected by what side he's on. Remind me, did we hear clicking or just smacking sort of sounds when he was on the breast? All right. All those signs that he is taking in excess air.
Yeah. So
you had been going to a chiropractor.
That one of his cranial discs was, kind of slipped out, and that he was way more tight than a newborn should be.
In addition, your pumping, it was key in the beginning. You knew to pump so that you could protect your milk supply, while we're trying to get him more effectively transferring milk.
He wasn't nowhere close to sleeping through the night and just waking up around the clock. So this was around when he was 3 months old. Borderline colicky, and we had used natural gas relief medication.
A lot,
like on a regular basis. Daily. And that seemed to help a little bit, but it certainly didn't solve the problem, and also people had commented how much he was throwing up. And as new parents, we didn't really know,
how much is too much.
How much is too much, and the pediatrician said all these things are normal, but looking back, the frequency and intensity of them were not normal. Thought that must be something else kind of going on, and every time you'd go to the chiropractor and get an adjustment, we would have this magical night, or like this day and a half where he did seem to sleep better. He didn't actually throw up as much, and but it never stuck at home. So it wasn't until you really suggested that we could look into this, into the frenulum, and you had sent a couple of articles about it, and one of them was a link to a physician's page that had a ton of symptoms, and it said your baby might have this if, and I looked through the symptoms, and the only ones that we didn't have was cracked or hurting or bleeding nipples and weight loss, but we had all of the other symptoms.
But the key things were his discomfort. You said when he laid flat, he seemed like, he kept waking himself up, almost like, it didn't sound like he was choking, but you felt like he was kind of
coughing.
Yeah, coughing, working on clearing his airway. And you said he often had congestion, especially in the morning.
Yes, and apparently breastfed babies, that's common. Again, these are all common things. According, our pediatrician, who's excellent, said, stuffy nose is common, but again, I felt like it was so stuffy he really couldn't breathe. And so it finally got to the point where the pediatrician said, well, I think maybe we should, I'm very against medication, but we should consider it for the acid reflux.
Were you hesitant when we talked about an ENT and possibly needing a clipping?
No, I was all for it. I did try to get a referral with our HMO through the pediatrician, but because he wasn't losing weight, we got denied. So we ended up having to go on our own and did it out of pocket. But we realized that the surgeon there said that he also had a significant lip tie as well. Well, he just automatically, he kind of looked a little different, and he seemed more relaxed. He definitely was not spitting up as much. The coughing, he rarely ever coughs anymore. The congestion, instead of having to do a saline spray on his nose like 2 to 3 times during the course of the evening while he's sleeping, I maybe do it every 2 to 3 days.
Oh my goodness.
Instead of sleeping or waking up every hour to 2 hours throughout the night, he, on his worst night, that would be maybe half the night. So, but he's going, at least like a good 4 to 5 hour stretch in the beginning every night.
So he looks like a different baby.
Yes.
He looks more relaxed just looking at him.
Yeah, instead of getting the feedback from people that, does he have colic? We get the feedback, your baby is, like, never cries, your baby is so chill. It's like, yeah.